Dr. Vuong, when people replace teeth, one of the ways to replace is obviously with dentures. And dentures are, well, they're not necessarily or not at all as good as implants and stuff like that, but of course they're much lesser in cost. So tell us about, you know, the use of dentures, the disadvantages of dentures, because obviously they've got, I mean, it's probably a lot better to have dentures than to have nothing. Go ahead.
Yeah, I think through the years of practice, I think there's dentures have become less and less common in today's world, but of course there's still a need for dentures. Well,
actually, I heard a number, and I'm not so sure that number is correct still, but I heard that current number, more or less, give or take, is 30 million in the United States. That's a lot.
That's true. That's probably true. I think a lot of the patients that need the partials and dentures, simply not a lot of them can afford to get them. And so there's probably a good number of them that just haven't gotten them but need them real bad.
Wait a minute. You say the people do not get the dentures, or they don't get the implants and haven't gotten them, does have in between, in the interim, have the denture?
I think both. Both.
Interesting.
I think both. I think there's a lot of patients that they have a lot of dental problems, they don't have a lot of money, and they choose to just take out their teeth, and they don't do anything else. But there's a big need for...
And look like a dried out tomato.
Yeah, but there's definitely a big need for partials and dentures.
Mm-hmm.
And I think there's you know, patients that definitely need to come see the dentist and get those done.
Well, tell us about dentures. Tell us, so I mean, you know, people, let's talk about something else here, actually, about the same thing, but dentures. But apparently there's this new thing out there, I call it a hybrid. Basically, it's implant-supported dentures, where, you know, instead of the old type of dentures, which is basically, you know, glued on it almost, and sticks there, and it always feels a little wiggle-woggly, especially after a few years, and has to be adjusted, and patients apparently lose a tremendous amount of confidence once they have this denture in it, just because it reminds them of grandpa and grandma, and then, you know, and kind of like, oh my God, now I'm old, which they might be, but might not really be. But either way, the implant-supported denture apparently is a wonder, because it's tremendously cheaper than all implants, and yet is just about as good. You can eat spare ribs and apples with it, and that's important in Washington where you are, since you have so many apples there. Is that true? So did the denture improve drastically compared to before?
Yes, definitely. One of the hardest things about dentures is they move around. They're not comfortable because they move around. They start causing sore spots, and they don't allow us to get a lot of bite force on fake teeth, basically. And now with the invention of implant-supported dentures, the implants pretty much lock the dentures in place and minimizes the movement of the dentures and gives us great, just really fabulous bite forces. All my patients that have gotten implant-supported dentures love them. They swear by them. They totally recommend it.
Right. Is it possible that sometimes or often a person comes in with a denture and it's not yet too loose, basically it's not yet too worn out like a, you know, 100 years old pair of shoe, that you can change the existing denture into an implant denture? Is that a possibility?
Yeah, that definitely is a possibility. We simply retrofit the denture. We place the implants and then we retrofit the denture to make it fit the implants that we just placed.
Because in that case, the person is basically saving the money of the original denture.
Yeah. If their denture teeth are still in pretty good shape, there's no need to make it a whole new set.
Mm-hmm.
We could just retrofit this existing set.
Mm-hmm. Okay. All right, wonderful. And obviously, either way, it's a lot less expensive because there's only 2, maybe 3 implants involved, which is a lot less money than 15 or whatever otherwise one would have to have.
That's right. For the bottom jaw, we recommend 2 to 4 implants, and for the upper jaw, we recommend 5 implants.
So many, huh?
Yep.
Okay.
Yep.
All right. But again, that's a lot less than otherwise.
Otherwise, you have to get 10 implants for the top. 14 implants for the top and 14 implants for the bottom. That's 28 implants. Nobody wants 28 implants.
That's deep in the pockets, isn't it?
Yeah.
All right. Well, so that's it about dentures. And let me ask you, the implant-supported denture doesn't cover the palate anymore. You know, like normally in order to have the denture working on the palate, I mean, to sit on there, you have the plastic or the metal over it, and thus you can really not taste the food on your palate, which is the main area where you taste the food. And once you have an implant-supported denture, that falls away. You now can taste the food again the way you used to when you had normal teeth. Is that true?
That's absolutely true. For upper dentures, the denture covers the entire palate, and the reason why it does that is it creates a suction so that the denture can actually stay in place. One of the drawbacks to that, though, is, like Helmut said, lack of taste, because it covers the taste buds, and some patients even gag on it because it goes so far back to the soft palate that they can't tolerate it. So implants have its place because it allows us to cut away the palate, and which, allows for more natural taste and also prevents gagging. And it makes the denture smaller and more comfortable.
Beautiful. Gorgeous. I mean, that's something, because let's face it, eating comfortably, eating the foods we want to eat, the foods we like, accustomed to, I mean, let's face it, it's a huge part of our life. I mean, we barely these days go to a seminar, be it continuous education for you or whatever it may be, where part of the thing is, do they serve food? If they serve food, I'm on it, right? It's, I mean, every, business meetings and just the normal, I mean, be it any family meeting, food is it. All over the world. I've traveled all over the world. I've worked in 14 countries, and let me tell you something, it isn't different anywhere. Whether you visit people at home, or, you get invited into their town, I mean, they kill you if you don't take their invitation to their favorite restaurant they're having. And they want to pamper you, they want to pay for it. It wouldn't matter how poor they are and how rich you are. They want to pay in their restaurant, in their town. So if you can't eat anymore, I mean, for some people, I'm not so sure I would fall into that category. I think I would, because I'm pretty, I like food. But you would almost kind of say, I mean, now life becomes worthless if you can't taste and eat what you want anymore. I mean, it's probably not quite as drastic when you really get there, but it must be devastating. Yeah?
Yeah, most of us live to eat. Definitely live to eat. Very few of us
eat to live. That's a that's very well put. Thank you, Dr. Vuong. Bye-bye.
Thank you.